stain you can detect that if it is pairs or chains, then it can be streptococci, or it can be if you see in cluster it is staphylococci. Okay, the gram staining is one method. It's a routine lab technician method. But what if another method is that is catalase test. Catalase test. So what it is catalase test? So the organism, okay, just remember that the staphylococcus has the catalase enzyme, while streptococci doesn't have catalase enzyme. So what it catalase test means, this catalase enzyme presence gives positive catalase test, and positive catalase test it is present in staphylococcus cocci, not in streptococci. Understand this? So staphylococcus will have catalase test positive, but not in streptococci. So catalase enzyme is not present in streptococci. So what is catalase test? That catalase enzyme will catalyze. Catalyze means break down, or you can say it destructs. So catalyzing a compound called H2O2. H2O2. What is H2O2? It's an hydrogen peroxide. It is an hydrogen peroxide. So hydrogen peroxide will be differentiated into water plus oxygen. Okay. So the catalase enzyme will catalyzing the H2O2, that is hydrogen peroxide, into water plus O2. Also can be used as a mouth rinse. Okay, you don't have to swallow it, you just have to gargle it with equal amount of water. For example, you are using 2 ml of water plus 2 ml of H2O2. Okay, so if you are using H2O2 2 ml, you have to take exactly the same amount of water, and you can do a mouth rinse. It's a useful for disinfectants of the mouth also. Okay, but with a proper care. If you feel any side effect, just consult your physician. I am not giving advice you do with this thing only, but I am just explaining that it is also beneficial for this. And so side effect of H2O2, what you will see that it can cause redness, irritation where you apply. So it's all about H2O2 and the catalase test and catalase enzyme. Okay, we are rubbing this and moving towards another topic. Explaining things sometimes can be a worrisome. It's very hard. Now we are moving towards different agars of Staphylococcus. Okay, used nutrition agar, blood agar, and it can be a MEDKIRK agar. MEDKIRK, blood agar, MEDKIRK agar. You can use a salt, so it will be called salt agar. You can use a phenol, phthalate agar. Okay, everything has their own special thing. Also, there is I have forgot one thing, milk agar. It's very important. So these 6 agars, there are many agars in the market, but these 6 are very important. So nutrition agar, blood agar, MEDKIRK, what are the different features between all of them? So here we will write Staphylococcus. Okay. So characteristics, what will be characteristic? It is a non-motile. Non-fastidious. Non-fastidious means it gives negative Zeal-Nielsen test. Gram positive test, it gives, we have performed the gram staining. Gram positive, it gives a negative test. Non-motile and it's non-sporidious. It's non-sporidious. Non-sporidious, okay? It is not spore forming, it's non-sporidious. It's non-motile, non-fastidious and gram positive. And its favorable temperature is favorable temperature is 37 degrees Celsius, but it can be also in a range 12 to 44 degrees Celsius. This is a range, but its favorable is 37 degrees Celsius, and the favorable pH is 7.5. Neither it's a basic or acidic. It's almost 7.5, near to neutral. So pH favorable will be 7.5 pH. So you all know that pH scale is from 0 to 14, okay? So it's nearby to neutral. It's all our characteristics of this. It's a gram positive. Purpura clusters you will see. Non-motile, non-fastidious, and there are 3 species about Staphylococcus and many more variants about the subspecies also. So this is clear. This is agar. This is agar. The other side, this is some characteristic. Okay. Now we will move to the nutrition agar. We will grow this bacteria on this nutrition agar plate for 24 hours. For 24 hours, after 24 hours, you will see the colonies of Staphylococcus with 1 to 3 microM in diameter. Okay, 1 to 3 microM in diameter, and the color you will see golden yellow pigment if it is Staphylococcus aureus, and also some other species also show golden yellow pigment, but most of the Staphylococcus aureus has a golden yellow pigment, and the colonies the colonies will be glistening, the surface will be glistening, okay, this glistening, and the colonies will show this color of golden yellow. It is nutrition agar. It is placed for 24 hours incubation. See, this bacteria is aerobic and also non-aerobic, so it works in aerobic condition, also in anaerobic condition. But the main thing is to remember that this bacteria produce more pigmentation on the aerobic condition, not in anaerobic condition. It can be incubated on anaerobic condition also, but the aerobic condition means that oxygen dependent condition, it produces more pigment. So on the nutrition agar, if you have the aerobic condition incubation, the pigmentation will enhance more, okay. And also there is another condition in which the pigmentation enhancement is more, is that if there is presence of more fat. So if there is more fat, there will be a lipolytic reaction and you will see more pigmentation. So the presence of more fat can also be one cause for the enhancement of the pigmentation. So please remember that aerobic condition is very favorable for more pigmentation enhancement. And as we know that this bacteria works on both aerobic and anaerobic condition also. So we also know that mannitol fermentation is been seen in Staphylococcus aureus species only, not in S. epidermis or neither on S. saprophyticus. Okay, so Staphylococcus aureus fermentation of mannitol, there will be no production of gas, only acid. So detection of mannitol fermentation will occur in Staphylococcus aureus, but it will occur by anaerobically, so no oxygen will be needed, okay, in anaerobically process. That point has to be remembered. It can be asked in MCQ. So moving towards this golden yellow pigment in nutrition agar, yellow pigment, and also it is an facultative anaerobe, okay. This is facultative and aerobe. We will discuss all the aerobe, anaerobe, facultative, aerobe, anaerobe in a separate video. But just now, just remembering this facultative, anaerobe, and also aerobe, aerobe, and also facultative anaerobe. Okay, non-fastidious. Yeah. Okay. So the difference between nutrition agar and blood agar will be similar. It will also show golden yellow pigment colonies, and also you have to keep for overnight. For overnight, the difference is minor. Okay, blood agar and nutrition agar. But the one distinguishing feature between a blood agar and nutrition agar is that on blood agar you will see hemolysis. Yeah, and the Staphylococcus species are responsible for beta hemolysis, not alpha, neither gamma. There will be a beta hemolysis, so you will see a clear halo around the colonies grown on blood agar. So here it will be colonies. So colonies, the colony is here, its presence. There will be a clear halo. Okay. So you will see a clear halo here. There will be a clear halo. Okay, because there is a hemolysis. The hemolysis is beta hemolysis. Beta hemolysis. Beta hemolysis generally occurs of the human blood also, sheep blood also, and other animal blood also. Okay, you have to remember beta hemolysis. Clear halo will be seen, because the clear halo, you will see that space between the colonies and the background. Okay, so there is a wide space because of the denaturation of hemoglobin. So the difference between nutrition and blood agar is only that there is a beta hemolysis in blood agar, where there is nutrition agar there is no hemolysis, and also the pigmentation will be same, that is golden yellow pigment both in nutrition agar and blood agar. And while in McConaughey agar, the colonies color will be pink color, because of lactose fermentation. Because of lactose fermentation. For more details, you can see the textbook of 11th 12th science. You can know the lactose fermentation process and that all. I will not teach that. Okay. You will see pink color on McConaughey agar because of lactose fermentation. Now we will move to the sixth one, milk agar. What is milk agar? Milk agar also will produce this colonies, but it will be larger. Colonies will be larger than nutrition agar. This milk agar incubation overnight you have to get overnight. For overnight you have to keep these colonies, and the colonies will be larger colonies than nutrition agar comparison. Now salt agar. What is the use of salt agar? So you have to add NaCl some proportion, 5 to 6 proportion or 7 to 10 proportion on already colonies of present. Okay, already the colonies are present. You have to add this NaCl compound, because the NaCl helps in removal of all the dirts and dust particles which is present in again along with the colonies. So help of salt agar is to remove the dust particle and that all thing. And phenolphthalein agar, for that we have to clear all this. We have to give a great concept of phenolphthalein taste. Phenolphthalein. Okay, what is phenolphthalein? What is characteristic of phenolphthalein is very important, because it's one of my favorite taste. It's one of my favorite taste out there. Phenolphthalein. It is characterized as pink color. Okay, and also it has a potential that it gives a pink color on alkaline medium. It grows alkaline medium. It not grows, but it shows its characteristics more on alkaline medium, and phenolphthalein gives a pink color. Just remember that this thing is very important. Now, what to understand that when you have the agar containing the phenolphthalein, so we take an example of sodium, compound name sodium, phenolphthalein diphosphate. This is a compound, it's not very hard, just mug it up. It's a compound, you can use it, can be asked on MCQ also. It is an agar containing the compound this, okay. Now what the use of this thing is that there is an enzyme called phosphatase. Phosphatase, it is present in staphylococcus, and this enzyme is very much essential to differentiate between species of staphylococcus, okay, between staphylococcus epidermis or staphylococcus saprophyticus, or between staphylococcus aureus. The main thing is phosphatase concentration is more in staphylococcus aureus. There is presence on there is mild presence of phosphatase in epidermis also, but more concentration is present in staphylococcus aureus. So this golden yellow pigment has more, containing more phosphatase enzyme, okay, this is an enzyme. So this phosphatase concentration is positive, and the role of phosphatase is that it causes the phenolphthalein X. There is phenolphthalein, it's a prison break for phenolphthalein, because phosphatase removes this phenolphthalein from this compound, okay. So phenolphthalein is itself gives a pink color on alkaline medium. So what we will use, we will consider, for example, this is a duster, and consider this is a agar plate, and here is this compound. Now on presence of the colonies of staphylococcus aureus, this phosphatase will remove this phenolphthalein when it comes to the presence of an alkaline medium, because then only it gives a pink color. So what we will do, that we will put this agar plate containing this phenolphthalein on a gas called ammonia. So ammonia, NH3, this is colorless gas, a colorless gas, very pungent smell, very bad smell, containing NH3 ammonia, pungent smell, okay. So what will occur, so this plate, when we place, invert it by opening the upper shield and placing inverted on the colorless gas, this is colorless gas NH2. So when it reacts with this plate, what will occur, it gives a pink color, because we know that phenolphthalein is giving pink color on alkaline medium. So alkaline medium is what, NH3. So NH3 ammonia. And how it gives the pink color, because the result of prison break means removal of phosphatase, and it occurs by staphylococcus containing phosphatase. So staphylococcus which will occur, staphylococcus species called S. aureus. So S. aureus contains phosphatase, and this phosphatase will remove phenolphthalein from this compound and gives pink color when on exposure to ammonia, which is alkaline in medium, okay. It's very important to distinguish between S. aureus and S. epidermis and S. saprophyticus, because the concentration of phosphatase will be highest on S. aureus. Just remember one thing, so it is all this taste of phenolphthalein to distinguish between S. aureus and S. epidermis and S. saprophyticus. There will be no evidence of phosphatase in S. saprophyticus, but there will be weekly presence of phosphatase in S. epidermis, okay. We will discuss more of S. epidermis on further lecture, but just remember that there is a weakly presence or absolutely no presence of phosphatase in S. epidermis, and the more presence in S. aureus, causing this pink color when it reacts to ammonia. Okay. So seeing this pink color colonies on agar, you can easily say, so when it comes in contact with alkaline medium, the agar plate, it gives a pink color colonies. So you can distinguish this pink color colonies S. aureus from S. epidermis. This test is very helpful when there is a mixed infection. Okay. So I am giving given a case scenario. In your clinic, one old patient comes to your clinic. Okay, he has some bruises and skin infection. Okay, skin infection near to genitals or near to any body parts, and he's a drunk man and he doesn't remember anything. So what is the thing here is that you don't have the proper history. Okay, and you are starting some antibiotics on that patient but not doing antibiotic sensitivity test, and just going with antibiotics, you think that is gram negative or gram positive, and you think it is a gram positive. Okay, and you have the idea that it should be a gram positive and doing some antibiotics. Okay, now what will happen, you will give some antibiotics but you don't know the species what causing this infection. So it can be a mixed infection of gram positive, and also it can be two species of the same bacteria. So how to differentiate it? So this test will help in this scenario, that to differentiate between S. epidermis and S. aureus, it can be helpful, because S. epidermis can be also be present in indwelling catheters or indwelling catheters, heart valves, or it can be present in many other scenarios. So it's very important that you have to differentiate between these two species when the same organism is involved and you are not getting the proper diagnosis. So you can use this test to differentiate between two species. And remember one thing, same organism can contain 2 to 3 or many more species, and the one species of that organism has also many variants. So if you are talking about influenza, it has many species also. Okay, but it has also many variants. So understanding what I'm saying. So coronavirus, you can say it can mutant. This virus and bacteria have some tendency to change, but the DNA thing is quite stable. But RNA, it can causes rapidly changing, and there are many variants. Okay, so it depends what you are dealing with. So, so, so it is the test to differentiate these things. Now there is another test called coagulase test. Now discuss that thing. Coagulase test. Coagulase test. It has to be differentiated for Staphylococcus aureus, because it gives positive coagulase test, while negative it has to be given by Staph epidermis and Staph saprophyticus. Negative coagulase test, negative. These are negative coagulase test. These are coagulase test positive. What is coagulase test? So coagulase test, for coagulase test we will use test tube and slide. So for coagulase test, we know that the presence of free coagulase, when there is presence of free coagulase in test tube, and you see some colonies and you detect that there is a gram positive infection of staphylococcus and it is catalase positive, and the indication are giving towards gram positive, catalase positive, coagulase positive, then what will be coagulase positive? So for example, it is a free coagulase. Okay, what will happen, that free coagulase will bind to coagulase reacting factor with prothrombin. If you know all the 13 factors of hematology, your blood, you know. If you have studied, you understand that there are 13 factors in blood clotting process. Okay, 13 factors. The last is fibrinogen. Yeah, 13 factors. So there is prothrombin. So what? Free coagulase reacting factor and prothrombin. So now I have to give this that coagulase reacting factor is present in human blood and sheep blood, but no in guana pigs. Guana pigs doesn't has this coagulase reacting factor. So we cannot experiment this thing in guana pigs. So we have to experiment in human blood and sheep blood only. So the free coagulase will bind to the coagulase reacting factor plus prothrombin. Okay. Now what this will occur? Now this three combination causes fibrinogen conversion into fibrin, causing clotting. Clotting occurs. Fibrinogen conversion to fibrin because with the help of CRF, that is coagulase reacting factor, and free coagulase in a test tube, not in slide, because in slide there is different scenario. In slide you will not see free coagulase, there will be a bound coagulase. I will give you a proper understand after this test. So there is a free coagulase, it binds with coagulase reacting factor plus prothrombin. So after that it will cause the fibrinogen conversion, that 13 factor, into fibrin with the help of this all the three. So you will see this clotting. This clotting you will see in test tube. This is coagulase test positive. Coagulase test positive means it is an S aureus. Okay. If there is a coagulase negative, we have to go with no biosin sensitivity test. In which if it fits positive, then we have to go with S epidermidis. And if it's negative, then we have to go with S saprophyticus. And now this is the test tube method, in which it is free coagulase. Okay, free coagulase. Now in slide method, what is, there will be presence of bound coagulase, there will be no free coagulase. What the difference is that in slide and test tube method, in test tube there is free coagulase, in slide there is bound coagulase. So in bound coagulase there is no need of this CRF factor, there is no need of coagulase reactive factor. So it will directly convert the fibrinogen into fibrin. There is no need of this CRF factor. So it makes us life easy. So it directly converts this fibrinogen into fibrin. While in this we have some bridge, we have get some intermediate that we need CRF. Okay. So the blood of guana pigs via this test tube method, it can show positive coagulase test because it doesn't need CRF. But in the test tube method of coagulase positive, you have to have CRF that is present in human blood, as similar as an sheep blood, but not in guana pigs. You cannot experiment this blood of guana pigs in test tube method to find coagulase test positive. So the point is the free coagulase is present in test tube, while in slide you will not see free coagulase, it will be a bound coagulase. Okay, so bound coagulase will directly work on fibrinogen conversion into fibrin, so you will see clotting. So it is also coagulase test positive, but because of bound coagulase, not free coagulase. Here will be also clotting, but because with the help of CRF. So it's a concept of coagulase. I will drop this, and we have some minor tests now left. So catalase done, coagulase done. Now we have to differentiate Now we have come to the second point, differentiation of some species. I have talked earlier in this video only how we will differentiate S aureus, S saprophyticus, S epidermis or epidermidis. Okay, S epidermidis, S saprophyticus, and S aureus. So on nutrition agar, nutrition agar, you will see golden yellow pigment, while S saprophyticus lemon yellow, it is white colonies. It is white colonies, lemon yellow colonies, and it's golden yellow colonies. Phosphatase enzyme presence positive. I will add two. It's my own. You will not find in any other text, but only plus is there. But I am using double plus because to indicate there is more phosphatase compared to other. Here also there will be positive, but very less, or also absent in S epidermis. Okay. This is nutrition agar, golden yellow, lemon yellow, white, and very less or also absent. This is positive, strongly present. Okay. There is a mannitol fermentation. There is mannitol fermentation. It is positive, negative, and phosphatase is negative in saprophyticus. These three states can also distinguish. Now we have we have also this test name for phenolphthalein test. Positive, negative, because here also it can be give some positive, but it's very less, so it's almost negligible, so it will be negative also. Yeah, these are the tests, some of the famous tests. And if you use McConkie agar, there will be pink colonies and S aureus also. I think that's very hectic for you to see these videos because it's very content wise great amount, and also it's very quite hard to remember all this stuff. But if you are used to it, it's very easy. I think it's very easy. It's not very hard. Everybody has different pace and scale. So upon your scale, you have to memorize all these things. Okay. So these were the differentiation. Now we will move topic wise upon the species. So as epidermis, as saprophyte, we will do a discussion on details about the species, causes, diagnosis, treatment. These were the distinguishing features. What are the difference between them? Now we will do the what they causes, what they helps, what they causes, and what are the other impacts on human life. Okay, so we will go topic wise topic. There is S aureus, epidermis, and another. There are many bacteria. We will go every topic with a depth, and with a good content. Okay. And if you feel that I am teaching hard or very in a speed mode, and if you think that, and please comment down, because it's quite lengthy micro, and it's quite detailing thing, because you have to learn in detail to have some MCQs get clear. So, and also the videos are getting big. I am caring about this thing, but it's quite hard to explain why it's getting big, because content is more. I will try to divide it. Hope so. Have a good luck, prepare hard. See you on the next video. Okay.